And sorry, yeah, you can see it has been placed at the bottom of the trench and is separated laterally. The splitting is incomplete. Rotate it and repeat it. Now it has been completely split. There are some other videos which I will show. Trenching is done. This is a soft cataract. Blood reflex is already there. Instruments are placed at the bottom and it is cracked, and again it is done. This is a harder cataract, grade 3 to 4. We need more phaco power for trenching. Can see a faint red reflex. Rotate it and continue the trenching on the other side for subincisional nucleus. Now, here I am widening the nucleus, the trench, to make the leverage for the instruments and to make, I am placing it at the bottom and I am separating it laterally. I am doing it on the other side. So now I will talk about the chopping. Chopping is a technique where the nucleus is divided into smaller pieces with a chopper. The chopping can be vertical or horizontal. The chopping of the nucleus, if you chop the nucleus directly, we call it direct chop. And if you chop the nucleus, nuclear halves or quarters, you call it stop and chop. So I think this is the most difficult step for a beginner, the chopping, vertical chopping. Here vertical chopping, we are using a sharp chopper or CNC cook. The phaco tip is embedded in the face of the nucleus. Here I am doing a cortical cleanup. Then I keep embedding it in the face of the heminucleus and in foot position 3, and then go back to foot position 2 and for a tight rock solid vacuum hold. A vacuum hold is the key. You have to hold it tightly. Then chop. How to chop? I'll explain once more. We are rotating it to the other side. Some sort of cortical cleanup. Vacuum is built. The chopper is kept near to it, vertically down and laterally. And it is already cracked. Here, it is horizontal chopping. The technique is essentially the same, but only thing is that we are pulling the phaco probe and spin the nucleus from periphery to center. Here we use a horizontal chopper. I am going behind the anterior capsule and pulling the nucleus from periphery to center. So these are the basic procedures: trenching and chopping. So we make use of trenching in the divide and quarter technique, and trenching and chopping in stop and chop technique, and chopping in direct chop technique. This is a divide and conquer. This is, I think, this is ideal for a beginner to start. Divide and conquer. Center trenching. Rotate the nucleus. Trenching it in the opposite direction. Deepen the tension and can separate the and divide the nucleus into 4 hemiquadrants. 4 quadrants, and we are emulsifying it one by one. This is stop and jump. Stop and jump is the most commonly used technique anywhere in the world. Trenching has been already done. Now I am splitting it with the vertical chopper. And it is being done on the other side also. This is direct chop. Direct chop I'm directly embedding the phaco probe into the nucleus. This is a hard one. And with the help of a vertical chopper, I am splitting it into two. You see the space for is less. Again, I am rotating. I am doing a vertical chop to divide the and to the split the nucleus. And I am emulsifying it one by one. Rotating in the other side, I am doing the same thing. A word about phacoemulsification. Phacoemulsification or cotton remote is done in the central safe zone where it is in the, away from an iris, posterior capsule and cornea endothelium. And make sure that we should use adequate OVDs for these procedures. Bevel should be down or sideways. Left hand is doing all the maneuvers and right hand just holding the phaco probe. And last nuclear piece should be ideally removed by in epinuclear mode. These are my settings for sculpting, chopping and quadrant. And thank you so much. Phaco is all about nucleus management. Techniques look deceivingly simple for a beginner, but it needs time and experience to master it. When you want something, all the universe conspires in helping to achieve it, says Paulo Coelho. Thank you so much.